Then before we go do next case, e get some kind sicknesses wey don dey kill people now. No be HIV o. In fact, this sickness don dey kill people pass HIV. And no be hepatitis o. Now one sickness when be say before, when we be children, if we hear say person get that sickness, the first thing we go come our mind na elderly person, and the next thing we go come off our mouth now, wetin they think? Hypertension. Hypertension now don dey everywhere, including children wey no reach my age. Hypertension. Where they get hypertension? I don't know. Wetin dem dey think? I don't know. Sometimes food wey we dey chop, our lifestyle dey responsible for many of the things wey dey happen to us. But as e be say I no be authority, e get somebody wey be authority. Our own one and only Dr. Otabor of Alliance Hospital. He dey for studio, make we appreciate am. Doctor, see your seat there, sir. We no go appreciate am, abi. This man don do treatment for our patients totaling over 40 million naira within this space of time where we dey engage am, free of charge. We no reach to appreciate am. He do am so tey shame no dey allow me refer patient to am again, because me I get am for mind. Before I send the patient, I get small money where I go. He no go talk say no. When I remember one lady wey call me one night, wey her leg pieces, wey enter motor, wey one chance throw away am along the express, wey another motor match am, wey she dey go, dey do traditional so tey leg con dey go, spinal cord don dey go. Wey she call me, wey I carry her go doc. In fact, if doctor, welcome, sir.
Thank you, Honorable President.
Yes, sir.
I have good news for you concerning her, Mariam. She was discharged from the hospital last week. She's doing well.
Yes, introduce yourself properly, sir.
Good morning, Mr. Ordinary President and members of Brekete family. My name is Dr. Christopher Otabor. I'm the Medical Director of Alliance Hospital here in Abuja. Thank you for the opportunity that you give to me to talk to Nigerians about matters that affect their health. And because sitting in my hospital there, we receive a lot of patients, and I look at the pattern of morbidity and mortality, which means the way people they sick and die. So I decided to pick out a few of the causes, the commonest causes of death and disease among Nigerians. And one of those things is hypertension. So I want to really talk about hypertension because to a large extent it can be prevented. And so ignorance is the biggest problem we have as far as that disease is concerned, because hypertension is silent. When you begin to have symptoms that relate to hypertension, then we're already late. And so we need to look closely into that. The heart, as we all know, is one of the vital organs of the body. It begins to beat when we are in the womb at the age of 5 weeks inside the womb. When the woman is 5 weeks pregnant, that's when the heart of the baby begins to beat. And it beats throughout life. Anything that threatens that beat, if it stops for a few minutes, then that will be the end of life. And every other disease that affects the human body that leads to death, ultimately it will lead to the heart stopping. Yes, before the person can be certified dead. So as we get older, from childhood into adulthood, things change in the body that affect the blood pressure, and then the blood pressure many times begins to rise. When the blood pressure gets to 140 for the systolic, over 90 millimeters of mercury, we say the person has hypertension. Okay, so if you can have 120 over 90, that is hypertension. You can have 140 or 150 over 80 or 70, that is still hypertension. So that's just the crude definition. But when we get to the hospital level and scientific level, we further disaggregate the figures and, you know, and classify it according to age and all that. Okay, so it's estimated that about 40%, between 30 and 40% of Nigerian adults have hypertension. That means, yes.
How many percentage?
About between 30 and 40%.
Get hypertension.
Yes. So, or will have it. So it's very common. There was a study that was done last year. 72 million Nigerian adults is estimated to have hypertension. That's a whooping number. What is the problem with hypertension? The problem is that the pressure of blood coming from the heart is so high that it has what we call end organ damage. All the vital organs in the body begins to have repercussions from those sustained blood pressure. Yes, and starting from the brain. The commonest cause of stroke is high blood pressure. That is
the
not
commonest.
Controlled. The commonest. And we find people all the time, even today, there will be many people that would be rushed to the hospital as a result of stroke. Yes, today I'm telling you, you can go around the hospitals in Abuja, you will find at least 5 people that have been rushed to one hospital or the other because of stroke. And hypertension is by far the commonest cause of stroke. Why? When the blood pressure is sustained at that high level, the blood vessels in the brain, they can't take it. It's like passing water at a high pressure through a pipe. And the hypertension itself weakens the pipe. So over time, the pipe will burst. If it bursts in the brain, that will lead to a stroke. Or blood clots would form and block the passage of blood. That thing can also happen in the heart. Because though the heart is the one pumping most blood to other parts of the body, the heart also requires blood supply for its own survival through some vessels. If those vessels are blocked or burst, it now also leads to what we call a heart attack, or heart attack, just for the common language. But we call it a cardiac arrest because the muscle of the heart cannot do its work. Okay. Then too, with high pressure of blood coming from the heart sustained, it can knock down the kidneys. When I came here last time, I talked about kidney failure. And I said that we do a lot of kidney transplants in my hospital. One of the commonest reasons, after diabetes, the next commonest reason why we do kidney transplant for people who have failed kidney is because of hypertension. Yes. So the blood pressure, the kidney is receiving a lot of heat from the blood pressure, high blood pressure from the heart. And over time, the kidney packs up. Say, I'm tired. You know, the same. It goes down like that. It also affects the eyes. Hypertension leads to blindness, very commonly, because the blood vessels of the retina, the part of the eye that makes us to see, it receives a lot of heat from the high blood pressure. So over time, when it is not controlled, the eyes goes blind. Then lastly on this, but there are many more, but let me just stop with this. For men who have sustained high blood pressure over time that is not controlled, it makes them not to be able to perform in the other room. I believe, yes. So it leads to erectile dysfunction.
They affect area 1?
Yes.
What about the zone 2? So hypertension, they affect area 1?
Yes, seriously.
Plus zone 2?
Yes. So even gangrene, sometimes we do surgery to remove the leg. Last week I did an operation. I had to do an amputation for a middle-aged man. You know,
because of what?
He's hypertensive and also diabetic.
Hey.
So it leads to the arteries in the lower part of the body, the hands, the legs, becoming occluded, and then it leads to gangrene of the feet. And
sorry,
then you have to
we have somebody on the line. Hello, the good Barrister Uche was wrong here. Good morning.
Good morning, Ordinary President.
Yes, sir.
How are you, sir?
Fine, thank you, sir.
It's just to thank you for the dimension we are taking these things now. To especially thank Professor Moghalu. I've been dreaming to meet him. And I trust he's one of the people that, God willing, will be able to, God will use to transform this nation.
Amen.
He's qualified. He has an excellent track record. And we trust that as we are using this process, we produce him or somebody like him that will get it right in this nation. In Jesus' name.
Amen.
Thank you so much.
Thank you very much, Barrister Uche Uwazironye, the barrister. Well, let's appreciate Barrister Uche Uwazironye. Continue. So, hypertension can cause many things.
So many things.
Including affecting area 1.
Yes.
You know, the one where they hear, they say na side effect of medicine for diabetes, it affect area 1. They say side effect of medicine for hypertension, it affect area 1. I don't know, say the sickness itself, they affect area 1, because you when you hear man. Now that one be man, no. So
okay, so
when you hear Mogalu, you not go fit to look if Morgan no dey there. Continue.
Thank you, sir. So one of the reasons why Nigerians don't survive beyond middle age, beyond 60 and above, the commonest reasons, 2, diabetes and hypertension. Yes. So you hear that, oh, the man sleeping, not wake up, it was hypertension. Most of the time. Because if that stroke happens at night when he's sleeping and the major blood vessel bursts, he won't even make it to the hospital. Yes. So sudden collapse in the office, and then they are rushing. Many times they rush them to the hospital and they are already dead.
You get one big man for one big politician. Then they wait for him downstairs, then they go event. He don't wear agbada, do everything. To come down, that's all.
Yes.
Now dead body then carry.
So it's very common. So what are the causes of hypertension? Okay, there are some, generally there are 2 types of hypertension, primary hypertension and secondary. Primary is the commonest. We call it essential hypertension. Nobody can tell you that this is the cause, but there are risk factors. The risk factors are the things that predispose people to hypertension. So the risk factors that we cannot do anything about. Number 1, increasing age. As we get older, our blood vessels, instead of being plastic and pliable or elastic, it becomes hardened, and that the heart needs more force to push blood through it, and that leads to hypertension. Then another factor that causes hypertension is family history. If someone's parents,
then they inherit them.
Yes. If your parents have hypertension, you have a very high chance of ending up with hypertension. It may not show up when you are young, but by the time you combine genetic, the hereditary trait with age, it becomes more likely that one would have hypertension. But these are things that cannot be controlled. But the things that can be controlled, which people need to know about, are Ordinary President, you mentioned it in the course of this introduction. You talk about lifestyle yes, our eating habit and all that. So when people sit down in one place and they are not active, it's a predisposition to hypertension. When people are big, obesity is a risk factor for hypertension. When people smoke, smoking has been known to be a major risk factor for hypertension. And when you stop smoking, the risk also reduces. Then the type of diet that we eat, excessive fatty food, because it causes the fat to block the arteries, and so the heart will have to push with extra effort to overcome that blockage. So that leads to hypertension. So these are some of the things that can predispose to hypertension. But by far, the 2 commonest factors are the age and the genetics. But other things that I have mentioned, they potentiate it, they make it more likely for it to happen.
Is it possible for a young person to have high hypertension?
Yes, very possible. For young people who have hypertension, they mostly have secondary hypertension, which means that this hypertension is caused by something. I saw a 12 years old girl who had hypertension. So it's a mystery because it's not supposed to be.
So secondary hypertension in young people.
Yes.
Then university hypertension in
okay.
Polytechnic
So secondary hypertension is there must be something that is causing it. That's 12 years old girl that I talked to you about. By the time we investigated, we discovered that the kidney, the blood vessel to the kidney, we call it the renal artery, was narrow. So that's because of that narrow blood, that's constricted blood supply to the kidney. The heart was trying to overcome it by pumping more. So I had to refer her to the surgeon who opened up the blood vessel.
And that was
all the high blood pressure.
Look, we appreciate Dr. Otabor.
So other things like hormonal factor, hormonal imbalance, and other little things in young people can lead to hypertension. But by and large, the big burden of hypertension is in the middle age. As we cross 35 towards middle age and old age.
Thank God I never reached 35. Thank God. Thank God.
Okay, so the what is the management? What's the management for hypertension? First of all, we have to have an awareness, because it's stated that more than half of Nigerians who have hypertension don't even know that they have hypertension. That is the problem. Because, like I said during the kidney talk, if you see a stone coming, most likely it will not blind your eyes. You can dodge it. But if you're just moving about thinking everything is fine and your heart is crying, because hypertension can lead to heart failure. Yes. The heart is over pumping. After some time you say, I'm tired, I'm not doing it.
Something which cause power failure. Why heart failure no go
so that lack of awareness is the biggest problem for hypertensives in Nigeria. Because if you go around check people's blood pressure now, you will find that a lot of people, you that just went to randomly check, you will be the one to tell them that your blood pressure is high. So that's why when people come to my hospital, as a necessity, they must first do their vitals, and blood pressure is one of them. And that's how we even diagnose hypertension, because they came for other reasons. And so we are using the opportunity to screen people for hypertension. So it's advisable that people must check their blood pressure, especially when you are 35 and above. You must check your blood pressure at least once or twice in a year. That can save you the embarrassment of being rushed to the hospital or the risk of being rushed to the hospital as a result of complications of hypertension.
Thank you.
Then if the blood pressure is discovered to be high, leave the rest to the hospital. We have cardiologists who will handle it, and they will either, most of the time, it's lifestyle modification. Just exercise and a few other things, and you'll be fine. You don't even need medication. Yes, it's only when the blood pressure is now too high, you will need a medication to bring it down. But before I conclude, and before I take questions, if there will be, now, once you have hypertension, once you are diagnosed as hypertensive, you don't take medications for 2 weeks, go finish it and continue. That's another mistake people make. You have to constantly be in touch with the hospital, with the doctor who knows what he's doing. Even if it's just to show up, say, I just came to check my blood pressure, and they say, oh, your BP is fine. Okay, fine, thank you, see you in 3 months. We don't have to do much for you.
Sometimes some hospitals, consultation fee alone, you see, you don't reach money where person will take pays children's school fees. Consultation.
But you can. There are other places. Government hospitals are cheaper.
Okay.
But again, it is far cheaper to pay for consultation fee and check your blood pressure than to be brought in with one half of your body not working because of stroke. So at the end of the day, it's cost-benefit analysis.
Thank you very much. Thank you.
Ordinary President.
Give us your phone number, sir, please, so that people go feel reach you.
Okay. I'll give you. Sorry.
Elder, you want to ask question?
I wanted to
Now.
ask him questions. Thank you very much, Ordinary President, for bringing this. This is very, very educative. Quite a lot of people would have been interested in this because it's a commonest disease now. Every day we find people talking about it. Now, what I wanted to say, because I know one head of state who talked about this, he said he has been managing his own situation, the former head of state, sorry, and that people should be able to manage their own situation. Are there ways of managing hypertension and diabetes in such a manner that you can also age before probably nature calls you?
Thank you very much, sir. Very important question. And this is the beauty of knowledge. We have a lot of patients who are 80-something years old, and they will tell you that I have been hypertensive for the past 45 years. And some are 80-something, they will tell you that I have been diabetic for the past, 40-something, 50 years. So this is something that you should be, it's manageable once you do the right things and make the right contact with the hospital. The only problem is when you play the ostrich and you think it's not important and you walk away. The problem is in you, and then one day a complication will bring you back to the hospital. So when the first thing is, when we meet patients with hypertension or diabetes, we want to first find out at what level is this patient, what is the damage that has been done so far, what can we reverse in this. Okay, because you may not know. That's why we do echocardiography. We want to check the level of damage to the heart already. We check the brain, we check other organs, the kidneys. Once we are sure that these are fine, then that will help us plan your treatment. We would plan for the lifestyle issues. We advise people to stop smoking, stop drinking, because excessive alcohol also leads to increased blood pressure.
What of ogogoro?
Yes, it's alcohol in the concentrated form. Yes. And then we advise them to exercise and all those things. Then that's the first layer of the management. The second layer of the management is pharmacological treatment, where we give you the medication and we titrate the medication until we get what is suitable for you. Some people say, doctor has given me X drug, maybe amlodipine, 10 milligram, that's what works for me. That can work for you for 6 months or 1 year. You can't continue taking it in perpetuity. That is another problem. People come to the hospital, they give them drugs that helps, moderate their blood pressure. They just walk away, go to the pharmacy and keep buying it for the next 3 years. That dose may not be suitable for you after some time. And also the medication your body may not respond to that medication as it used to be at the beginning. So you need to keep on going back to the hospital for
either
review.
they reduce the dosage or they increase the dosage.
Or change the drug altogether. So that's important. It's important that you see anyone who does not know whether he's hypertensive or not, it's your responsibility to find out. And anyone who is hypertensive, who knows, it's your responsibility to keep your blood pressure normal.
Thank you. Give us the phone number, sir.
Okay, so I'll give you the hospital number.
Yes, sir. Please.
I can't give my. Okay, 080 971 42 623.
You go reduce the speed. Number one, after the first 3 digits, the remaining ones you separate them to 2 digits.
Okay.
Are we ready? Yes.
080 97 14 26 23.
This now Alliance Hospital phone number.
Front office.
And not be the one way when I go on fold the man hospital because he did good. Even me where they do the thing for because of me, I don't dey shame to go there. So no kill. Nigeria person where they do small good, we go mount pressure on him till he no go fit do again. Doctor, I beg, no overdo. You hear when they talk about overdo?
Yes, sir.
I beg. Now when your legs stand, you feel pay salary, you feel do other things, pay light bill and the rest, then you go feel you continue with you. They do. Give us the phone number
yes,
again.
Sir. Okay. 080 97 14 26 23.
Thank you very much. Make we appreciate Dr. Otabor
Thank you, Ordinary President.
of the Alliance Hospital.
Thank you, sir.
The number to call now plus